So I know you guys are getting probably kind of tired of these videos, and trust me, I'm tired of making them. But I do like to, excuse me, I like to talk about my health. I'm keeping it in there. I want to talk about my health. Um, again. So this is like an update of sorts. Am I off center? Get over here in the center. There we go. So here's what's happened. Um, I had a GI done today. Um, they put me over and or put me over, put me under. They, oh God, and I don't even have the paperwork on me. I don't know where the paperwork went. That would be interesting to talk about. Oh, jump cut, and I'm back. So, this has a bunch of information about what happened to me today, and they go over in detail about um what they go over in detail about everything that they found out about me. And I'll talk about what they did, what it was called, and everything. So let's get into it. I had an EGD, an EGD, and it was an endoscopy, but it was an upper GI. Um, so my doctor was Doctor. Actually, I don't think I should say. I think I'm gonna leave that out. I'm not gonna say my doctor's name. Um, so we're gonna talk about the procedure. They put me under anesthesia. And when they put me under anesthesia, I was out. Like they had me hooked up, and all of a sudden my head gets tingly. Right, my head gets tingly, and then um I'm out. Like after that, nothing. Um, I will say that I woke up kind of loopy. I was laughing. I was off my rocker. I was I was I was not well, but in a fun way. In a fun way. So I don't want to mention names or anything. So there are indication of gastroesophageal reflux disease, as well as an H. pylori infection, and those are the indications. Um, so the procedure, indications, preparation, and potential complications were explained to the patient. They did do that. Who indicated understanding and signed the corresponding consent forms. TIVA was administered by anesthesia provider. Continuous pulse oximetry and blood pressure monitoring were used throughout the procedure. Supplemental oxygen was used. Patient was placed on my left side, left lateral decubitus position. I'm not sure how to pronounce that. The endoscope was introduced through mouth and advanced under direct visualization until second part of the duodenum reached. Patient tolerance to the procedure was good. The procedure was not difficult. I'm a trooper. Limitations and complications. There were no apparent limitations or complications. So the findings. Here we go. Esophagus, mucosa. Localized erythema of the mucosa was noted in the gastroesophageal junction. These findings are compatible with esophagitis. I hope I'm pronouncing that right. Findings appeared consistent with non erosive esophagitis. Multiple cold forceps biopsies were performed for histology. Yeah, so before I went under, I said take whatever sample you need. If you see something going on, take a sample. Just do it. Don't there's no need in putting me back under later for it. Go for it. I told them that. Yeah, the findings appeared consistent with non-erosive esophagitis. Multiple cold forceps biopsies were used performed for histology. Stomach, lumen, a small size hiatal hernia was seen. Small size, it's not very big. Seen. Retroflexion view in the stomach confirmed the size and morphology of the hernia. Patchy mucosa, patchy erythema, congestion, scarring, and nodularity of the mucosa was noted in the antrum and stomach body. These findings are compatible with gastritis. Multiple cold forceps biopsies were performed for histology. So they took samples. The duodenum. I had this is all they put on the paper. It just says normal duodenum. There was nothing to say about the duodenum. Impressions. The duodenum was normal. Uh, Erythema, congestion, scarring, and nodularity in the antrum and stomach body compatible with gastritis. They did the biopsy. Hiatal hernia. I don't understand these numbers they put here. So it's 553.3 dash K44.9, and I don't know what that means. I have no clue what that means. Um, the erythema in the gastroesophageal junction compatible with esophagitis. They had a biopsy. I don't see they have all these numbers listed here, and I don't know what that's about. So EGD transfer biopsy, single multiple gastroesophageal reflux disease without esophagitis. Other specified diseases of esophagus, other diseases of stomach and duodenum, blah, blah, blah. Patient documented not to have experienced any of the following events: a burn prior to discharge, a fall within the facility, uh, or a hospital transfer or hospital admission upon discharge from the facility, gastroesophageal reflux disease without esophagitis. So there's that bit of information. So let's keep going here. Uh, Jar 1 and Jar 2 biopsy in the gastric antrum body BX tests requested, and a histology comments cold BX. I don't understand some of the stuff they put here. I will not mention the doctor's name. I feel like I made a mistake mentioning my primary care physician's name. He's a dick, but I shouldn't be talking and mentioning names. So I feel like he's a dick. I feel like he pokes fun at everything. Like anything that I'm taking seriously, he's making jokes and trying to act like a jackass, and it's pissing me off. I'm fixing to find a different doctor. Um, let's see. Yeah, they have a listing of allergies. I won't go over that. Medications I reported taking, and I don't know if it's okay to mention medications on YouTube. I don't know if that's allowed to mention things that you're on. So just in case, I'm gonna skip that. I don't feel like it's important to everything they found. The doctor's thing. Discharge instructions. We performed your procedure due to an indication of gastroesophageal reflux disease, and an H. pylori infection. The H. pylori is still there. There's still an H. pylori infection. It has not gone anywhere. Uh, but they said there's gastroesophageal reflux disease. Recommendations are as follows. They want a follow up to the to a follow up office visit in 2 to 3 weeks. Instructions, it says await pathology results. So I believe that has to do with the samples they took. They're waiting for the results on that. So follow up of the biopsy results. During the procedure, we removed and submitted tissue samples for analysis. We will notify you by mail within 10 days of your results. Okay, so 10 days. 10 days. Let me see what today is. 2, 3, 4, 5, 6, 7, 8, 9, 10. Oh, okay. So not this Friday, but next Friday. Lovely. Next Friday. Not this Friday, next Friday. Okay. We will notify you by mail within 10 uh, days of your results. Protonics, 40 milligrams. This is what they want me on. Something called Protonics. 40 milligrams PO once daily. They want me to avoid NSAIDs, as in certain painkillers. They want me to avoid anything acidic. GERD ulcer diet education. Follow a GERD ulcer diet as directed by your physician. I don't know what that is. I guess I need to look that up. I don't know what a GERD ulcer diet is. I'm probably not doing a very good job as it is. Been eating different things that I probably shouldn't be eating, uh, which isn't good. But it's when it comes to eating, I am very stubborn. I guess it's yeah. So do not drive, operate machinery, make critical decisions, or do activities that require coordination or balance for 24 hours. It's because of the medication the stuff they put me under with. But I'm fine. I'm fine. I'm not going to do any of this stuff. I'm just saying that I'm fine. Drowsiness, weakness, and lack of coordination are the result of the medications that were used during the procedure. Actually, I've been having these issues prior to the procedure. So, yeah. Try sips of water first. If tolerated, resume regular diet or the diet recommended by your physician. You may feel nauseated today. Nope, I feel okay, except for the bloating. I got a lot of bloating. Uh, you may feel nauseated today. This may occur due to medications that were used for your procedure. I would have had it anyways. This should resolve within a few hours. If your nausea continues for more than 24 hours, contact our office or your physician's office. You had an EGD performed. You may have a mild sore throat or hoarseness after. That's what I am having. I keep wanting to cough every now and then. If the doctor performed a polypectomy or biopsy, he did eat a soft, low fiber diet for 1 to 2 days. Son of a bitch. See, I didn't read any of this stuff when I left the hospital. I was just hungry. I had Taco Bell. Crunchy tacos. I avoided regular burritos or anything like that because gluten has been a problem for me lately. It's been a problem for a long time. Actually, gluten has been very much a problem. Anyhow, you may have a mild sore throat. Blah blah blah. Go directly to the emergency room if you notice any of the following: chills and or fever over 101 Fahrenheit, persistent vomiting, severe abdominal pain, other than gas cramps. I've been having pain prior to this procedure, so yeah. Okay. Call your doctor's office. Oh, it's continued from here, like all the stuff that pain, abdominal pain other than gas cramps, severe chest pain, black tarry stools, and any bleeding exceeding 1 tablespoon. Wow. Okay. Call your doctor's office to make a follow-up appointment. Resume taking all preoperative medications unless otherwise stated by your physician. If you have any questions, concerns on the above instructions, call the surgery center phone number, yada, yada, yada. Just looking for everything about. Ah, here we go. This is about gastritis. Gastritis is an inflammation of the lining of the stomach and can be caused by several different processes. Who gets it and what happens? The stomach has a protective lining of mucus that prevents stomach acid or other things from irritating the stomach tissue. Inflammation can develop if the stomach's protective lining is damaged or weakened. Conditions of substances that increase your risk of gastritis include bacterial infection, which is H. pylori, Many people infected with Helicobacter pylori develop a chronic gastritis. That's me. Regular use of non-steroidal anti-inflammatory medications such as aspirin, ibuprofen, or naproxen. Uh, okay, so if I keep using that, yeah, I haven't. I've been avoiding that. I've had acetaminophen. That's not going to cause that. Increased age. Aging causes the stomach lining to begin to thin. Alcohol use. I don't drink. Significant stress, such as major surgery, injury, or severe infection. Bile reflux. Now that right there might be something I'm dealing with because of stress, such as major surgery, injury, severe infection. I've been having panic attacks and all kinds of stuff going wrong with me. I still don't feel great. Haven't been feeling great since they did this. What are the symptoms? Symptoms can include upper abdominal pain, yeah, often gnawing, burning, or aching that can change with eating, nausea, vomiting. Uh, I've been nauseous, but I haven't been vomiting. Feeling very full after eating only a small amount of food. Yeah. Uh, Decreased appetite. At one point, I couldn't eat at all. So, how is it diagnosed? There are several tests that may be performed. You may be tested for an infection with H. pylori, which may be done with a blood, stool, or breath test. An upper endoscopy may be performed to look with a camera in your esophagus, stomach, and small intestine. Small tissue samples can be taken and examined under a microscope. Sometimes X-rays of the upper GI tract will be obtained. That's that all the how's gastritis treated? Treatment is directed at the cause of the inflammation. Irritating medications may be stopped. If H. pylori infection is diagnosed, antibiotic therapy will be prescribed. Medications may be used to decrease the levels of acid in the stomach. This can improve your symptoms and create an environment in which the stomach tissue is more likely to heal. Yeah, I ain't been taking that. He's got me on I stopped taking it because it's absolutely destroying my B12 in my system. That's what's causing panic attacks and whatnot. I was taking it's a proton pump inhibitor. Okay, what can I do? Stop smoking. I don't smoke. Avoid alcohol. I don't. Spicy, acidic, fried, or fatty foods. Jesus Christ. Avoid spicy, acidic, fried, or fatty foods. Okay. Avoid coffee and caffeinated beverages. Okay. Avoid NSAIDs. In other words, those, yeah. Manage your stress levels, as stress can make the inflammation worse. That has been a chore, an absolute chore because of my B vitamins just taking a nosedive. Esophagitis is irrit. Oh yeah, this is the other thing that they said that they found. Esophagitis is irritation of or inflammation of the esophagus. The esophagus is the tube that carries food from your throat to your stomach. Esophagitis can be painful and can make it hard to swallow. I haven't had too many issues with that. Gastroesophageal reflux disease, or GERD, is the most common cause of esophagitis. When you have GERD, stomach acid and juices flow backwards into your esophagus. Yeah, your esophagus. This can irritate the esophagus. What are the symptoms? Common symptoms of esophagitis include heartburn, pain when you swallow, trouble swallowing food or liquids, chest pain, may be similar to pain of a heart attack. That is the sharp pain I keep feeling in my goddamn chest. Sometimes it also causes nausea. I haven't been vomiting, but I have had nausea. Fever, I've had that, and I've had belly pain. How is it treated? The treatment you need depends on what is causing esophagitis. If you have esophagitis caused by acid reflux, or GERD, your doctor will likely recommend that you change your diet, lose weight if needed, and make other lifestyle changes. Here are some things to try. If lifestyle changes alone aren't enough to help your esophagitis, your doctor may suggest you try medicines that reduce stomach acids. Yeah. Okay, so here's what happened when he had me on the stuff for stomach acids, and it's the reason I didn't keep taking it. I couldn't digest anything. Stuff was not digesting, and it was hurting like crazy as it went through my small intestine and everything. As it went through my entire digestive tract, it was an absolute nightmare. I remember going to the bathroom while I was on the medication. I remember going to the bathroom, and my stool looked completely un undigested. It just looked. I won't describe it any better than that. It was bad, and it hurt. And I really hate my doctor. I hate it so much. Maybe the medication is too strong. Maybe it's too strong. I don't know. The treatment you need depends on blah blah blah. Lifestyle changes reduce the reflux, gives the esophagus a chance to heal. Over-the-counter medications include antacids such as Tums, Maalox, or Mylanta. Stronger acid reducers as prescribed by your physician. All right. And that is basically the end of everything. That was like the last piece of paper, like several pieces of documentation here. So this is not groovy at all. This is, and it's hard for me because I'm used to eating a certain way. I have tried to change recently. I've been eating freaking hard-boiled eggs in the morning. I mean, I really don't know what else to eat. I tried eating just eating like vegetables, but that hurt. For some reason, vegetables hurt. Even after I cook them thoroughly cook them until they're almost mush, it still hurts really bad. Um, so Tums, Tums, or like I've been taking yeah. Okay, so there we go. I've been taking oh God, what is that medication called? I don't know the medication. I don't know what it's called. My brain's not working too well. I keep forgetting I can't pull the keyboard here with a mic here. Jesus Christ. Okay, so that's everything. So I've got GERD esophagitis, and I've still got H. pylori, and who knows what else because they took samples. Hopefully, nothing's cancerous. Like I said, I'll know not this Friday, but next Friday. And at that point, I'll probably do another one of these videos. Holy crap. And I apologize, but this is what's going on in my life. It's what's important. I've got, I haven't got much else going on, so doing a video on this is better than doing a video on nothing, or not doing a video at all, I should say. Uh, Today has been an ordeal. I'm not even sure what my diet should be. Talk to my I gotta talk to the jackass. I don't know if I should leave this on anymore. It just I'm so tired of wearing it. Jesus. Ooh, 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 ooh. Okay, so I don't know. I think it's time to take it off. Really, it's been on there all day. Oh, and the feeling of the glue from the it's uncomfortable. I don't know. It's like I said, it's basically been there all day, and it is just oh, let's just get this off. Okay. Oh wow. Okay. I just won't use my hand too much. Hopefully it's good. I didn't want to keep leaving it on there. Woo. They got me good. Woo. They definitely got me good. So that feels better. Whew. So yeah, I gotta avoid spicy stuff. Now I said I had Taco Bell, but let's be honest. Taco Bell's not that exotic, especially when all you get is a boring crunchy taco with a bunch of lettuce on it. It's mostly lettuce. And I am pretty thorough about the shell and all that. So I don't know. I'll leave that shit alone from now on. It was just that was the only thing I could think of when we went out when we were coming home. And I keep forgetting that this thing is an issue. I guess I'll put it back over here. Pull my keyboard back up here like this. Hopefully you can still hear me. So that's what's going on with me. I don't know what to do. I really don't know what to do.
Um, yeah. Anyhow, I'm worried. I mean, at one point I was an absolute mess. My B vitamins were an absolute mess. My B12, and I know that's what was wrong because both metformin, which is for type 2 diabetes, blood sugar control, both metformin and what is that other medication? Or not? Yeah, pantoprazole, which is a proton pump inhibitor. Both are known to cause depletion of B12, which is what was making me an absolute fucking mess. So now that I know that, I'm loading up on B12. I'm going to start back on these medications and just try to keep my B12 up as high as possible and hope to God I don't fall apart. Um, so yeah, and I think that's honestly it. That's all I got to. I I am a hairy man. Look at this. What is this? Look at that. I'm a hairy bastard. What is with these hairs? So yeah, and I'll report back when I hear more. I feel like I'm at the light at the end of the tunnel now, and it's just I don't know. We'll see how it goes. All right, later.